Hi, good day. My name is Dr. Anna Guerin. I'm the Director of Counseling and Psychological Services, and I'm so happy to be here with you today. So, when people are considering going to CAPS for support, they may have questions about confidentiality and what that means. So, what does confidentiality mean? That is a good question. Before I get to that, I want to remind you that clinical services here at CAPS are provided by psychologists, clinicians, and practicum students. All care is overseen by licensed mental health professionals. So essentially, we are required by law and by our professional ethics to maintain privacy of the details related to your treatment at CAPS, even including the fact that you have been treated at CAPS. So essentially, confidentiality means that what you share in CAPS stays in CAPS. It's your private mental health information, and we cannot release it unless you give us specific written permission to do so. However, there are some exceptions to this rule, and those exceptions include if there's an emergency. So, what does that mean? There can be a dire medical emergency, so we need to contact someone on your behalf to let them know that you're having a medical emergency. If you say you're going to hurt yourself or hurt someone else, this can also be a reason that we break confidentiality to seek support for you or for the other person. When it comes to danger to self or danger to others, it's always going to be a conversation between you and your clinician about how we're going to keep yourself safe or that other person safe. Another instance we would have to break confidentiality is in the case of what's called mandated reporting. All staff are mandated reporters. So if there's any instances of suspected child abuse, elder abuse, or dependent adult abuse, we would be required by law to break confidentiality and report that to specific agencies. Another instance where we would have to break confidentiality is if someone is conserved or in case of a court order, that is an order signed by a judge. In addition, you always have the ability to sign a release of information if you would like to share your treatment records or anything about your treatment with another health professional, or if you would like your CAPS clinician to support you in any type of way, we'd have that discussion before we talk to anyone outside of CAPS. So this is really important information for you to know. You can find out more information by calling CAPS. You can also find out information about CAPS services on our website through CLU. Just search CAPS and you'll find a plethora of information talking about services, about our staff, and if you need any clarification during this process, you can always let us know or talk to your clinician. But thank you so much, and remember to visit our website or our Instagram page for more info. Have a great day, everyone.